Obstetric history. Pregnancy can be a time of great excitement to the patient, but it can also be a time of danger and that can a certain serious illness of the pregnancy to be aware of. Below we will provide a framework for capturing the basic obstetric history. Previous obstetric history. A good starting point is to ask about the number of children the patient has given birth to. Next, sensitively ask about the miscarriage, stillbirth, ectopic and termination. The term pregnancies. For each previous pregnancy can carry beyond the 24 weeks, inquire about the following. Gestation. This is a previous preterm labor. This is a risk factor for the subsequent preterm labor. Mode of delivery like a spontaneous vaginal, assisted vaginal or the cesarean. And you can look for the gender, birth weight. This is a previous small for the gestational age. Baby increases the risk of the subsequent one. Complications like preeclampsia, gestational hypertension, gestational diabetes, obstetric and the sphincter injury in the 3rd, 4th degrees TL, and also the postpartum hemorrhage. Assisted reproductive therapies called ART, for example, ovulation induction with the Compifin and IVF, in vitro fertilization. Care providers like was the patient's care completely with the midwife or as the will there be any the previous obstetric input? If so, why? Then you can go for the aortic pregnancy. They are often conceived after a long period of time and after much psychological distress. It is important to be aware of this. In addition, use of ART can increase the risk of preeclampsia during the pregnancy. Other pregnancies like for pregnancy not carried beyond the 24 weeks, inquire about the gestation. Miscarriages can be classified into early pregnancy and the second trimester. If the early pregnancy, it is 12 weeks or less. If it is the second trimester, it is like 13 to 24 weeks. Miscarriages like outcome. They are spontaneous, medical management, surgical management, which will be the evacuation of the retained products of the conception. Terminations like the method of management, medical or the surgical. Identify the cause of the miscarriage or stillbirth. Example, abnormal parental karyotype, fetal anomaly. For ectopic pregnancy, ask about the site of ectopic. In case of management, expectant like a monitoring of the serum HCG levels. In case of medical, methotrexate injection. In case of surgical, whether it is a laparoscopy or the laparotomy, salpingotomy. This is the removal of a fallopian tube. Removal of a tube. Otomy. This is a cutting of a tube or sectioning of the tropoblastic tissues. Gravidity and parity. Gravidity, this is the total number of pregnancy regardless of outcome. Parity, it is the total number of a pregnancy carried over the threshold of a viability. 24 plus 0. Examples: patient is currently pregnant, had the 2 previous delivery, G3P2. Patient is not pregnant, had 1 previous pregnancy or delivery, G1P1. Patient is currently pregnant, had 1 previous delivery and 1 previous miscarriage, G3P1 plus 1. Patient is not currently pregnant, had a live birth and a stillbirth. Death of the fetus after 24, G2P2. Patient is not pregnant, had a twin pregnancy, G1P1, resulting in the 2 live births. First, ask about, in case of the current pregnancy, first ask about the gestational age of the pregnancy. Gestation is described as weeks plus days. That is, you can also use the post date. The last menstrual period date, LMP, can be used to estimate the gestation within Eagle's rule. The most common method to the first day of the LMP and add 1 year, subtract 3 months, add 7 days. This can be the imprecise as it requires accurate recall of the LMP date as well as a regular menstruation. Instead, pregnancies are dated based on the crown rump length measured by the ultrasound scan between the 10 plus 2, 10 plus 0 and 13 plus 6. This way, we avoid the unnecessary induction of the post date based on the LMP recalled later than in the reality, and we can also monitor the labor where the LMP date suggests is over 37 plus 0, but the scan suggests the preterm. In the history of the current pregnancy, ask about, has there been use of the folate prior to the conception and currently? Agree the estimated date of a delivery. This date is when the women will be 40 plus 0, singleton or the multiple gestation. Uptake and the results of the Down syndrome screening if scanned between the 11 plus 0 and 13 plus 6. At 18 plus 0 to 20 plus 0, the women are offered a scan to check the fetal anomaly. Be sure to review the findings of the scan. Fetal anomaly like presence or absence. Placenta position, check it whether it is clear of the internal OAS. Amniotic fluid index, you can check for the oligohydramnios, normal or the polyhydramnios. Estimated fetal weight, parameter for the growth. This is an ultrasound scan of the pregnancy at the 12 weeks, showing the measurement of the crown rump length. In case of the past medical history, ask the usual questions about the past medical history of abdominal or the pelvic surgery and the mental health condition. Remember that the medical comorbidities that are most likely to affect the women of the childbearing age include the asthma, cystic fibrosis, epilepsy, and the hypertension if they are older women. And you can also ask the diabetes, check if the type 1 or the type 2 one. Systematic autoimmune disease, example systemic lupus erythematosus, rheumatoid arthritis, hemoglobinopathies like sickle cell anemia and thalassemia, blood-borne viruses like HIV, hepatitis B and hepatitis C. In case of the mental health, this is extremely important. In the Saying Mother's Life report covering the 2011 to 2013, it was identified that nearly 25% of a death occurring the 6 months to the year postpartum were due to the psychiatric causes. The same report advised the following as a red flag to arranging the urgent senior psychiatric assessment. Recent significant change in the mental state or the emergence of the new symptoms, new thoughts or the acts of the violent self-harm, new and the persistent expression of the incompetency as a mother or the estrangement from the infant. Inquire about the previous psychotic disorder to include the depression, anxiety disorder, bipolar affective disorder, schizophrenia, previous self-harm or the suicide attempts. You can also ask the drug history. In addition to asking about the drug allergies and the intolerance, be aware that the embryonic, which is first 12 weeks and the period of a pregnancy, is thought to be the time of most sensitivity for the drug to cause a fetal structural defect, teratogenicity. Thus, inquire about the drugs taken around the conception and during the first 12 weeks. Inquire about the drugs currently being taken, include the cerebral complementary therapies. Ask about the illicit drugs and the alcohol requirement. Recommend the patient to stop these drugs and to offer the referral to help to pet services to recommend that the patient takes 400 mg folic acid per day for first 12 weeks to reduce the chance for the baby developing the neural defect. Family history. Although not usually regarded as a substantial part of the obstetric history, there is increasing the evidence that certain conditions are associated with the adverse pregnancy outcomes. Conditions such as cystic fibrosis and the sickle cell disease are heritable. The patient should be consulted as to risk of a baby developing this condition based on the parental genotype. A family history of a type 2 diabetes in the first degree relative is considered as a risk factor for developing the gestational diabetes. Here we can look for the mode of inheritance of the autosomal recessive conditions such as cystic fibrosis. There will be a carrier father and a carrier mother, both are unaffected. One unaffected will be a chance of 1 in the 4 chance, unaffected carrier 2 in the 4 chance, and the affected one if they are 1 in the 4 chance if they are autosomal and the recessive condition. Social history. Pregnancy can be a time of a great elation, intense anxiety, and quite possible a mixture of anything and everything between. Ask the patient about the thought of the pregnancy, being sensitive if the pregnancy is unplanned. Ask about the current of the previous occupation and the plans for returning to work. Inquire about the home circumstances. Who does the patient live with, like partner or spouse? Children in the home. Ask also about the support network like parents or in parent-in-law, neighbors and friends. Inquire about the financial circumstances like the cost of caring for the child in the addition to being out of work can potentially have an adverse impact on the patient's ability to cope financially. Is the patient eligible for the social security and the child benefit payments? Ask about smoking, how many per day, what drug like tobacco, cannabis and others, duration of smoking, would the patient like to quit and would they like help with this? Criteria the association between the smoking and small for the gestational age babies and offer her help to quit. It is also important to remember that at least once during the course of the pregnancy, women should be asked whether they were victim to the domestic abuse. Thank you.